right. Well, so you had already said that you're recording, and nobody else has said they're going to record. So the chairperson reserves the right to remove or have removed any person or persons for profanity, threats, or any continued disruption during a meeting. And at this time, I'm going to call the meeting at 5:09 and like to do a roll call. Carrie Mimitz here.
There's nothing cultural called Carrie Mimitz.
And John, if you could just say out loud that you're here, that would be great.
Yep, not here.
Great. Okay, so we're going to review the previous month's minutes and ask if there's any discussion from anyone. No? No, okay. I make a motion to approve the minutes.
Second motion.
All right. So then we're going to move on to number 2 on our agenda. Mike Hugo, is he here?
Mike is not here yet. I just talked to him. He was looking into a question for me, and he was going to hop on as soon as he could. So if we could just pass that for now and go back after, that would be fantastic. Is it okay if I do that and do the nursing update now?
That sounds great. Yes.
Okay. So for the nursing update, we are still in the red for COVID. Our wastewater numbers, the last one we had for Greenfield this week was 1.5 million copies, which is still really high. In the summer, we're usually around 300,000. So 1.5 is still up there. Our clusters are finally starting to decrease. We had a high cluster count of, I believe, 9. But things are stabilizing. And we did have one outbreak of norovirus, at least one that we know of, but that has now been contained. So I think that is it for the major nursing updates.
Great. Okay. So that moves us on to lunch, which do I understand we will not be discussing that tonight?
That's correct. We don't have an update on Lent tonight.
Okay. So will we table that? Yes. Is that correct?
Yes, sorry.
Is that okay? Do I need a second for that?
John, or Dr. Romano, would you like to?
Second.
Thanks, John. Okay, so all right, we're going to move on to restaurant updates.
Can we just say all in favor for the tabling?
Yeah. Yes, sorry about that.
That's okay.
All in favor? Aye.
Aye.
Thanks, Megan.
And Jess, do you want to go for the restaurant updates?
Sorry, little camera malfunction. Restaurant updates. So for the month of December, we had it looks like we had approximately 1, 2, 3, 4 separate restaurant complaints. Complaint 1 was resolved. That was at Bonnie B's. Complaint 2 was unfounded and resolved at the Hangar. Complaint 3 was resolved. That was at McDonald's on Mohawk Trail. And I'm sorry, there was actually 5 complaints. Complaint at the Subway on Mohawk Trail, that was resolved and unfounded. And there was additionally a complaint at the Speedway convenience store, and there was violations found there. Additionally, we have the January restaurants where we proceeded with continuing with Speedway. We're still working with them with reinspections and violations. We had 2 restaurant inspections that were completed in their entirety. and a third restaurant inspection that was completed in its entirety with 2 visits. That would complete the December and January restaurant updates.
Great. Would you like to move on to housing? Or the ones on the list anyway.
All right, so yeah, we can move on to housing. So going back, starting with December, we had in December there was 2 complaints regarding no heat. There was 2 complaints regarding outdoor trash pileup. There was an additional outdoor trash complaint that was a repeat violation, and they were fined. We had 2 receivership properties that had the condemnations lifted and are now properties that are usable and well. There was 1 emergency request for assistance from the police department regarding a welfare check. There was 3 complaints regarding mold, 2 of which there was mold observed. We had 1 long-term occupant landlord case that had been going on for a long time. That case has been closed officially. And there was 1 complaint regarding outdoor rodent infestation. That was for the month of December. January, we had 1 no heat and no electricity complaint. We had 1 fire department request for assistance. There was no health department findings at that point. We had 1 complaint regarding an occupant living in a camper. We had discovered a number of unregistered vehicles at another property and referred that to our buildings and zoning department. And we had 2 housing re-inspections related to previous order to corrects. And that would complete January.
Out of curiosity, when do I speak up on my home?
Not just yet. We'll let you know.
All right, just let me know. Thank you.
I think we are now going to move on to the unhoused update.
So for me, the unhoused update, I've generally been conducting the inspections at the Thunderbird, formerly known as the Days Inn. On December 12th, I did an inspection there. They were compliant. Revisited on January 12th for monthly inspection. There was some concerns that were addressed and corrected on site. So moving forward, I would consider that compliant, that no major issues to report. Everything was corrected on site. And that's the update for the unhoused.
Okay. Thank you. We'll move on to the perk and Title V.
So one of the things for the perk test is we don't have anyone at the Greenfield Health Department that right now that is licensed to do the perk test. The FERCog has offered to sign off on them and go and do the inspections, but they have to be voted in by the Board of Health first as a temporary thing. So we are hoping that you will vote in Randy Crozier to be able to do temporary permits until we get somebody that's certified.
Okay. So is that something, I'm sorry, first time sharing. Is this the point we would do that?
Yes, you could just make, if you guys are in agreement, you would just say, I'd like to make a motion that we temporarily allow Randy Crozier to sign off on septic inspections, and then they would need a second, and then an all in favor or any discussion.
All right, well, then I guess I am asking if Randy Crozier, was that that's his name? If we could move forward to having him assist with the Title V inspections.
It's a good life, I have to say.
Second the motion.
She was one of those people like when she came to see him, she's like, I'm still here.
All in favor?
All in favor?
Aye.
Sorry, I'm hearing background. Is that you, John?
Yep, aye.
Hi. So all in favor, aye, yes. And I think,
Yeah, and any discussion, and
Any-
the discussion would be between you and Dr. Romano.
yes, any discussion on that, John? I know.
Nope.
Oh, okay, me neither. Me either. Okay, moving on to academics and grants.
So we are working with the PHE grant. It's going well. We just hired another nurse, Robin Knipe, who moved from the COVID grant into the PHE grant. She's doing tons of activities for the grant. She's doing teaching marijuana shops to dispense lock boxes and to do education there so that children don't get into it, and gun safety. So this is not gun control, but teaching people to lock guns and to talk to their children about them. And she's done some vaccine clinics. She's absolutely fantastic. One of the things that we still need is an inspector for the grant position, because our inspector needed to leave for personal reasons. So that's on our radar. We also, Jen used to be the person that was able to vote, and I was the backup person for our PHE meetings. So we were hoping that you could change that, and I'm happy to be a voting member because I go to all of the meetings, unless you have an idea of who else might want to do it. Athena also attends the meeting, so I don't know if you wanted her to be a backup or if you had other ideas. But that would be another thing that if
Okay.
you could
Yeah.
make a motion. And
Yes, I could do that. And I don't have any other ideas at this point. John, do you have any thoughts on this?
I do not.
Okay. So at this point, I would like to make a motion to have Megan as a primary voting member for the Valley Health Steering Committee.
I'll second
And-
that motion. Oops,
Oh.
sorry. Good job.
Any discussion?
No.
No. Okay. All in favor? Aye. You said
Aye.
that. Okay. So are we moving on to parking lot at this point? Oh,
yeah, I think
Yeah.
so. So I think the first thing is the tobacco. So Greenfield in 2015, that was the last time we redid the tobacco bylaws that I can find in writing. And it's the state mandates that we have a certain amount of fines, and that is not negotiable. So for a first offense of selling to a minor, it's $1,000. Second offense, it's $2,000. And third offense, I believe it's $5,000. But that part we cannot change. What we can change is the suspension. Right now in our bylaws, it says that we have a 7-day suspension for each of those fines. Sorry. So we did have 2 violations that were second violations within 36 months of selling to a minor. So that's going to come up shortly. They can't appeal the money part of the fine, but they can appeal the suspension time. So as a Greenfield Board of Health, you have to decide what you want the suspensions to be. And whatever it is, whatever you choose, it's going to have to be that way for everyone so that it's equitable. It has to be a minimum of 1 day. No, and it doesn't, I believe the maximum is 7 days for the first and second offense. I'm not quite sure what the third offense is. So that's something that you can decide tonight, or you can just leave it be the way that it is now. You can listen to the, I'm sorry, the appeal, and then you can make your decision, and then you can decide, like, say you want to change it to a 3-day suspension. Then you could just change that next month so that everyone has a 3-day suspension from going forward. So I think that's something that you guys just have to think about what you want. We just have to make sure that it's going to be equitable, whatever you choose.
absolutely. Is this, so this is something I think I would like to table until next month. John, do you have Any thoughts on this until next month when we have our third member?
Yeah, no, I think tabling it until we have a third member is reasonable, and I think it does make sense to hear the appeal before we make a decision. But I think tabling it until a time at which we have a larger body is reasonable.
Absolutely. Okay, then all in favor of tabling, aye.
Let's second the motion, and I.
And so we're going back to the parking lot. That hasn't been discussed yet, I believe. And maybe.
Yes, I don't know. The city discussing updating the city website with proper contact information. I think that that's something that we probably could do as long as you're okay with it, about putting the new members on there and a way to contact. So I don't know if you want it to be your email addresses, or if, how would you like the public to contact you if they have questions? Or they can send it to the health department and we can forward it, whatever works for you guys.
Yeah, I think going to the health department and forwarding that would be appropriate.
Yes, I agree with that. I don't mind giving my email, but maybe we should all be on the same thought process. So yes, through the health department.
Send to be motion.
Yes, yeah. I second it.
All in
Then
favor?
Aye.
Aye.
I think that I'm not sure what that. Okay, so I think we go into the tobacco violations, and I think we have I believe Mohammed is here
Yes.
to talk about Mohammed paid the fine and he's appealing the suspension part. So this is something that he can appeal today. This is not something we should table, this part of it. We gave him the 7-day suspension because that was what was in the 2015 guidelines, but he would like to talk to you about reducing it.
Yeah. I do the new system before 2 weeks, and now I don't sell anybody. I told the guys here, you can't sell anyone under the age. Ask any customer about the ID, and now just scan the ID. I'm sure, I promise, I can't sell any people under the age. Please.
So you now have the ID scanning machine? Is that what you're
Yes.
saying?
I do this before 2 weeks.
Great.
That's great.
When was
Did-
that change implemented? Was it after the first the time that happened, or is it just after the second?
I am not before. I am new here around 1 year, 2 years.
Do we know when the first offense was?
It was within 36 months. I can't tell you exactly what the date was.
But as
Right,
of you have the scanner to scan IDs.
Yeah, now I do the scan ID, any customer.
Okay.
So just to clarify, I know we're going to vote a new sort of guidelines in the future, but this discussion is completely separate from that. We can make a decision that's not necessarily reflective of our future guidelines, correct? Just want to understand that, Megan.
I believe so. I think once we change the guidelines, they can be changed. Except the tricky part is that we have that in writing from 2015. But I would say that those aren't completely valid because back in 2015, the money fines were 100, 200, and 500 or something like that. So the money fines don't go along with that suspension. So I would say that those aren't completely valid anymore. So I think that at this point you can decide in these particular situations what you would like to do, and then decide in the future what we're going to do from this point going on.
Okay.
And so Mohammed, you are from the mobile, correct?
Yes.
Is the gentleman from the Country Mart on?
What you ask?
Oh, sorry, I wasn't asking you. I was just asking in general. We had another violation at the Country Mart. I didn't know if that gentleman was on the meeting. I know he wrote a letter to us, but I don't think so. I was going to say if we could hear both of the things at the same time, that would be great, but I think we just have Mohammed.
Okay. Again, just to clarify, we are just discussing Mohammed's situation.
I just wanted to point something out. So in this violation letter, it said that the youth went in with no ID. So the ID checker in this case would be obsolete.
Oh, okay. I see what you're saying. So Mohammed,
Yeah.
what she's saying is that sometimes when they do these checks, they won't have an ID with them. So does your staff know that if they don't come in with an ID at all?
Yes. If no ID, no, I cancel any cigarette.
Okay, so the clerk in this case did not ask for an ID or the youth's age. So just making sure next time or every time you're always asking for an ID, always.
Yeah, of course. Thank you.
So Megan,
So
Yeah.
Carrie, I think you and John can discuss what you would like to do, but whatever you do for the mobile, I would suggest that you do for Country Mart as well.
Yeah, it's hard to make a decision based on, you know, the information we have, because I don't know if the Country Mart has also implemented, you know, the ID scanning. You know, I don't know exactly what they're doing. It'd be nice to know and have some context, because if they're also making significant efforts to, you know, ID checking, then it'd be easier to make a similar decision for both.
The man from Country Mart, he did send us a letter, and he was in the hospital, and he said that he had somebody who doesn't normally work for him that was just covering for the day, and that's when this mistake was
They do
made.
it once a week. Okay. And on Thursday.
I'm not. I'm hearing a background
All right.
noise.
I just wanted to make sure that we're keeping.
Sorry,
an eye on
it's probably
it.
me.
Oh.
So, you know, I think you know, reducing the suspension would be reasonable, given that, you know, efforts are clearly being made. You know, it's a significant issue to be selling tobacco to minors. You know, it's a, you know, very serious health problem that, you know, cigarettes cause. But, you know, I think as long as, you know, these organizations are making clear efforts, and, you know, I can't speak on what Country Mart's doing, but at least having an ID scanner that's being used, making sure it's used consistently, I'd be putting, I think, to reducing the suspension. I don't know about taking it off altogether. You know, warranted. What are your thoughts, Gary? Because I think maybe 2 or 3 days. I don't have a clear, recommendation, but I think that would be reasonable.
I think that I'm not clear on how I may have missed how long he's actually already had as far as his time. Like, how much time does he have left?
We haven't started the suspension yet, so
Oh, okay, I missed that.
we were waiting because they did the appeal.
Yes, then I agree with John. I feel much I feel better about the situation having the scanner, and again, the Country Mart would be nice to know what they're doing, but if it was just one of these moments where there wasn't the owner, you had said the owner usually is there, I feel comfortable with I would say 3 days rather than 2. I don't know if John, if you agree with that.
Yeah, I think 3 days is reasonable. You know, I just want this to be kind of memorable, and, you know, next time people are on who aren't, you know, normally covering, at this point gets emphasized before their shift, and I think a short suspension will serve as a good reminder for that. So I think 3 is reasonable.
Yes, I agree, absolutely. So So as we're going to say 3 days, and I'm, without looking at my script, do you second that?
Center
And
Street, second floor.
doing something out of
It's
order?
not gonna hurt to
Maybe
do
you'll
it,
go
so
to
I would
Brown's
say that you
Tuesdays,
make a
Thursdays,
motion to
Saturdays?
reduce the suspension
Okay,
to
schedule?
3 days.
Okay,
and
okay.
then
And
second,
your work,
all in
I know
favor.
you said you're back to work. Is your
Well,
job
yeah.
something
And
that's
let's make
like?
reduce the sentence to 3 days. And all in favor?
Yeah, okay.
I second the motion and I vote aye.
Aye.
Okay. And so the last issue I believe we have is about the condemnation. Oh, actually, let me just look at sorry. I was going to look at the agenda.
Now we have the public
Okay.
comment.
So we have public comment. I'm just going to address Cassandra for 1 minute. Cassandra, just so you
Here.
know, I don't think that you need to say anything right now, because after public comment, we're going to table the discussion about the home. So for your privacy, you don't have to say anything at this time, and we are likely going to table the discussion.
What does
Which
that
means
mean?
we'll wait. We'll wait to discuss it until we get more information from the state.
What does that mean?
It means that you did some of the repairs,
Mhm.
but because there wasn't a permit, we can wait and see what the state says that we have to do, because you've done the repairs, the house is probably not condemnable at this point. So
I do want to add that we're able to get some of the trash out. We were able to get out of 11 bags I put out last night. They picked. I didn't put out. My man put out. We had 8 of them picked up, or 9 of them, because the other 2 were too heavy.
That's great. But I don't think you have to say anything else, Cassandra, today.
Okay, so at this point in time, it's waiting to see what the state says due to the lack of permit, which we didn't know we needed a permit for the electricity to be done. We just thought we
Yes.
needed a licensed electrician.
Yes.
So,
Yep, that's
So
okay.
what-
So we'll just wait. So you don't have to do anything today. If we can wait until next month.
next month, all right. So
Okay.
basically my home is saved at this point in time.
We have to go.
I'm trying to get home. I'm actually,
Okay.
that's all.
So, we're just going to go out of order. I know that this is a little unkosher, but we had something come up right before the meeting. So Carrie, and Dr. Romano, this work that on the house that we were going to talk about condemning, Jess had written orders to correct. Jess, do you want to talk about this?
Yeah,
Okay.
I would love to provide some input here. So some of the orders on the order to correct have been addressed, and at this time we would like to table the condemnation. We have seen progress happening at this property and valiant effort definitely being put in to make the improvements, keep and continue to make those improvements. So I would like to make a motion to table this condemnation.
Okay.
Do I have a second?
Uh,
The triage nurse, Megan.
I
Also,
second.
Megan's here.
I would like to table it until, again, we have our third member here.
All right,
And
and is everybody all in favor?
Aye.
Aye.
All right, so the motion carries.
Yes.
Perfect. Now we can go to public comment. Sorry about that, everyone.
And Glenn has comment.
Oh, Glenn, go ahead.
Good evening, everyone. I just wanted to give you an update on my appointment to the Board of Health. I will be sworn in on February 8th, next Thursday, and then that'll be official. And so I'm really looking forward to joining you all in your efforts in public health in Greenfield. So that's it for my update. Just wanted to let you know that there'll be a Board of Health of 3 soon, which should make things easier to get a quorum and everything else. So thank you.
Great, thanks, Glenn.
Peter has a comment.
Okay,
Peter, you're free to share.
yeah.
Sure. So I just wanted to, first off, my name's Peter McIver. I live in Greenfield, and I know the board has had previous dealings with the multifamily home that's listed on Coombs Ave. There's been previous discussion of a demolition order being issued. The previous owner of the property had crews in there a couple weeks ago before a real estate auction for foreclosure, and they've since removed the first floor boarding that was put up by the city. The property is now unsecured, partially open, and at the auction last week was sold back to the bank. So I just wanted to bring that to your attention and put it on your outlook. That's all. Thank you.
Thank you. Any other comments?
In December, okay. I
Can
wonder if it might be worth it to touch base with Dr. Revelation.
Can
I
see a
comment
hand?
on that?
Oh.
Am I allowed to comment on that?
I'll update.
Yes.
Okay. So he had come in here like probably a month ago and told me that he came and got the order to correct and said that he was going to be starting the work on it. He didn't tell me he was going to be selling it back to the bank. So that's kind of a disappointment that he just sold it back to the bank. So we probably will have to get it boarded and secured because I imagine that's going to cause a problem for people going and moving in there not safely. So that's kind of unfortunate. So thank you for bringing that to our attention.
I think Pam has her hand up.
Yeah, thank you. Hello, everyone. I just don't know who people are. So that's why I asked earlier about a quorum. I mean, I know Megan and I know Jess and I know Dr. Romano from previous meetings, but I'm just sort of sitting here going like, oh, who's that person? Who's this person? And I guess I'll become more familiar. I am excited about Glenn coming on board very soon. And I don't know what the background noise was, but it was really, there's a way to mute somebody that's got all this background stuff. And I was trying to strain to hear what we were talking about. So I would just call that to somebody's attention in the future. And also, are we on Zoom instead of hybrid because they're still trying to get rooms and places ready for hybrid?
This will probably be our last Zoom meeting. I know that we're supposed to be going hybrid from now on.
Okay, that's what my understanding. But I know sometimes people are at the Zon, people are at the City Hall, and so there's not, and they're getting ready, I think, to use the library. So I guess that's mostly it. I'm always glad to see what's going on. My last question or comment, when you say you're down an inspector, is that Nicole, who's usually in attendance? Oh, or are you Nicole next to Jess? I never recognize you. I swear. Okay. Yeah. I hate Zoom. I've been on Zoom a lot today. There you are, Nicole. Okay. Thank you. I was just concerned. I was like, I love Jess, but still, when you said you were down an inspector.
So this is for the Public Health Excellence Grant. So the Public Health Excellence Grant covers Greenfield, Montague, Sunderland, Deerfield, Leverett, and Shutesbury. And with this grant, we're able to hire another inspector to cover all of our towns so that if Jess was on vacation, we would have extra help, things like that. So that's the part that we're down, not the city of Greenfield.
We're always looking for extra help. Yay, that's great. Thanks for your time.
Not often.
All right, it looks like that looks like all the interest we have in public comment. If I'm not
Right.
missing anything. Motion to close public comment.
Yeah, and you sound good tonight. I don't know. I know last time we spoke, you sounded run down to me. Tonight you sound a little bit more energetic. Maybe I caught you at a good time, right? Yeah.
And I would like to quickly say to I'm new to the Board of Health. I've been to one meeting. My name is Carrie Mimitz, and I've been an RN in Greenfield for over 20 years. An OB nurse at the hospital for almost 20, and now for the schools in Greenfield. So that's a bit of me, and I hope to get to know everybody better. I will. That's it. So yes, I think that will be closing public comment. I don't see anybody else with their hand raised.
True, although I think there is a balance of listening to your body when it needs rest.
Technically, the motion to close public comment.
So
Yeah, second motion.
That's
All right.
All in favor?
But you're right, balancing,
Great.
time.
I think with that, we can make a motion to adjourn the meeting.
About feel like we need rest.
Right. All right. So, motion to adjourn the meeting. All in favor?
Aye.
Aye. All right.
Recovery might take a little bit longer.
Thank you, everyone.
Thanks, everyone.